guys. How's it going? Let's see if everybody can hear and see me yet. Let's see. Let me take off this watch so it's not making all that racket. Can y'all see the starting screen and hear me yet? Hey Eva, hey Amy. How's everybody doing? You checking up on chat here, trying to catch up. Not looking forward to July 12th. Aw. I got some really good E&M ones for you guys to go over tonight. I have a week and a half to build up my confidence. Aw. Work away, my friend. Maybe I'll get more right tonight. Aw. I hope you get them wrong. That's kind of crazy, but my logic is if you get it wrong with me, you won't forget for your exam when you take your certification exam. So the more you get wrong, the better I think I'm doing, because I'm actually showing you guys stuff that you just may not know, or stuff that you look at the question too fast and you pick an answer and you may have missed one little word or one little something. I don't know. I feel like I'm teaching you, so I hope you get them all wrong. Because I think you'll memorize them or learn something new for the exam that you didn't know before. So anyway, I hope you get them all wrong tonight. And I mean that with all my heart so that I can help you. You sent your resume. Awesome, awesome, awesome. It does take a few months to get on with CSI, but it's good. You don't want a company that's just throwing you in there super fast. They have to schedule you, somebody to train you, and they give you a month-long training. So it's great. I know you guys want to get into a position super quick, but I like the way that they hold your hand and train you through the system. So it's awesome. Yay, thanks. Hey, Go-Kart, how's it going? Hey, Johns. Hey, Jen. Hey, Amy, great. First time joining my live, Casey, awesome. And you're a subscriber to the YouTube channel. Thank you so much for the support. Hey, Deep, what are you doing here? Haven't you already passed? It's awesome. So glad to see you. Hey, Donnie. Hey, 206. Hey, Love Muffin. Oh, look, she did. Deep passed. Congratulations. And y'all remember, we knew Deep was going to pass. She ended up with like 7 100s or some craziness in some of her sections out of 14. Ridiculous. We knew that. We knew Deep was going to pass. Congratulations. Miss Webb, can you please go over radiology and anesthesiology? I have very low scores on my exam on the 12th. Radiology, good. That has 6 questions in it. Anesthesia only has 4 questions. So the main things that you need to know, yes, I'll go over that in just a second. Hey, Nancy. Hey, Victoria. Awesome. Studying for CRC. That's great. I hope to be able to help you guys out and get some more material for COC, CRC, and CPMA soon. I hope. I have 2 notebooks full of your notes already on the questions I've missed. Awesome, Amy. Perfect. Hey, Martha. You're not leaving me all so easy. Aw. Thank you, Deep. That's awesome. I'd hate to see you go. I will miss you, but hopefully you can get another certificate. So maybe you want to stick around for more certificates. Hey, Suzette. Rosalie's doing hers on the 12th. Miss Webb, you're getting 25% on them. Thanks, Victoria. Hey, y'all know I've been doing those podcasts recently. I haven't done any in 2 days. I'm sorry. I got to get back on it. I've been riding that darn scooter. But if anybody has passed and wants to talk about and do it like a little podcast with me about how they started looking into medical coding, what courses they may or may not have taken, maybe what workshops they've done, what was their whole process, and then what ended up helping them, even if it wasn't me, even if there was something else out there on the internet that was a different teacher, a different study guide, a different whatever. It'd be nice to do some podcast with anybody. So if anybody, you don't have to show your face, but if anybody wants to do some recordings with me, I'd love to get some of those out too. Good. Yes, AAPC does have free CEUs, and I post in my Discord group free CEUs. There was one this Wednesday. Let me get over here so I can get my little camera going on. There was, I think, one Wednesday, day before yesterday, I was supposed to be in that I forgot to go attend. But if you're in our Discord group, I have a room that is for CEUs right there. You just tap into it, and I had one. What day was this? June 28th. Yep, it was Wednesday at 1:30. It was free. It was all about injections and infusions for facilities. Even if you can't get a CEU yet, like if you haven't passed, you can still join these webinars and watch them. There are other educators, and it's free, even if you just listen to it. And a lot of times they give you PDF slides and all kinds of stuff to take away with it, along with it. I wish I knew how to do that, but I don't know how to do that. But a lot of their webinars come with extra takeaways that are super handy. But I post them in here for you guys. And look, that was the 12th. So that was, you had like 14 days notice on that. So super cool. Just don't forget to join my Discord group. The link is in the YouTube bio, by the way, which would be like way over here. The little blue dot that's right there next to the TikTok dot, that's how you join the Discord group. So if you've already logged in to your Discord, you've already set up your account, it's free, you can click on that little link and it'll throw you right into our Discord group if you haven't already joined. Super handy dandy, because it has so much information. I've got rooms with practice exams, rooms for job hunt, even job resources also has practice questions and practice exams that some of the jobs may even give you, anatomy resources, med-term resources, even CRC and CPMA, CCS, COC, CANPC, anything y'all want. I can make you your own room for it. What to expect on exam day is where you find out what books you need, what external camera you need, all that kind of stuff. This is a picture of how many questions are in each section, so you know. It's really cool, but you can just scroll backwards for 2 years worth of information, and it's super cool. Nothing's gated. We share here openly. We just use this as a study tool, so anything that is here stays here. Don't be copying stuff and sharing it over the internet, but it's all super helpful. Even got people sharing what they wrote, all kinds of stuff in these rooms. And if you are taking a course or anything and you have having a hard time, all you got to do is go into a practice question room and then post your practice question, and you'll get a response. Somebody will try to help you for sure, try to answer the questions. You can even see what kind of pens I use for notes. There's just all kinds of stuff in here. Super helpful Discord group. It's completely free for you guys. I'm seeing people charging $50 a month to join a Discord group on TikTok. I'm like, really? What are y'all charging for? This is anyway. Practicode, if you guys decide to do Practicode, I've got people that have finished Practicode and can help you out in here. You can even find where people have submitted for an ADA to get an extra hour on their certification exam. You can find that in the room of what to expect on exam day resources. And I have copies of letters that they've emailed into AAPC to get their extra hour. I have also the information if you wanted to get your apprentice taken off before you take your certification exam. You can even do that. And a copy of my email that I sent them and got back before I even took my CPC exam is in here too. So just scroll back. You can also do a search for any kind of information you want, like ADA. You could search ADA and then hit search, and it'll bring up every conversation that had about ADA and the pictures that were involved. So the Discord group is super handy dandy. Don't be afraid of it. I even have a room here about Discord tips right there. 4th room. You can go in there, scroll back to the very first video right there, and it shows you how to get in the Discord and roam around and what all the rooms mean and all that kind of stuff. There's 2 videos there that are super helpful, so you know how to navigate it. I'm still learning. There's stuff they want me to update all the time and fix, but I'm still learning as I go. But yes, y'all please join the Discord if you haven't. Super handy dandy. Why is my page all blank? There it goes. There we go. Let me get back into chat and see what y'all been chatting about. All right, we're going to go into anatomy. I got on that CEU rant. That's what I did. Don't forget there's 4 videos you can watch on the AAPC website that will show you the code to enter in for those videos is at the very end of the broadcast. You don't have to watch the whole video. You can just scoochie on all the way to the end and then type in the code in case it ends up being a meeting that you find that is boring. Nicole, it's going to happen. You need 1.5 by July 31st. Shouldn't be a problem. Victoria, reach out to me on Discord if you have an issue finding that last 1.5. No, Deep, you can't pass over CEUs for next year. So if you do too many, stop. Don't do any more because they won't go over to the next year. They'll just take them all away for this year, even if you did too many. So once you meet your quota for a year or 2 years, then you have to stop doing CEUs, which I hate. And you can't submit your CEUs until the month that they're due. So that's a huge pain because since December, I haven't been able to do any CEUs. I have, but they've counted towards nothing. So it's a pain. And I won't be able to submit my CEUs for this year until tomorrow. So I have to wait till July 1st, and then I can submit them. Once they're submitted, then I can start doing more that will count for the next 2 years. It's a pain. I hate it. I wish we need to talk to AAPC about that's just silliness. That as soon as we do them for whatever year, we need to be able to submit them. Just submit them. That way, the next sets that we do will count for this year or next year, or be able to say which year we want these CEUs to count for. We don't have that option. All right. Thank you guys for the thumbs up. Yes, yes, yes. And you want the differences between, okay, 86788, 89, 86777, and 78. Good. Got it. As soon as I go over anesthesia, I'll do that. You don't have to do Practicode to get the 2 years of experience off of you, but you can if you want to. I submitted my a friend who wrote a letter who said, I've seen Jen use the ICD-10, HIPAA book, and CPT in her daily duties, and signed it, put it on letterhead, and emailed it to me. I submitted that, and I submitted my college degree from 1994, my associate's degree. Great, Victoria. Okay, good. All right. Anesthesia. What I can tell you on the fly about anesthesia, I didn't prep any questions for today for anesthesia, but what I can tell you is that if you have not moved your HIPAA modifiers for anesthesia to your anesthesia guidelines, that's going to hinder you during the exam. You want to go find all the anesthesia modifiers, which is modifiers 23, 47, your P1 through P6. You also want to go find your AA, AD, G8, the number 8, G9, GC, QK, QS, QX, QY, and Z7. You want to find these, and you want to move these to this page right here in anesthesia, because that will help you out so much. They already have the P's here listed for you, but all those other ones, move them here. Super helpful. What do we need to know about anesthesia? There's 3 classifications of anesthesia. Anybody know what the 3 classifications of anesthesia are? Can anybody put it in chat? 3 classifications of anesthesia are, I'm going to turn to another page so nobody sees what that is. What are our 3? You remember QZ being on your exam? Yep, you want to be sure and have those. What's our 3 classifications of anesthesia? Let me get back up here to this so I can type on here. 3 class. Good job. We got general, Mac. What's the other one? I haven't seen that one yet. What's the other one? Regional. Good job, Gupta. That means like you know, a nerve block or something on the hand. So good. We know that. We got our modifiers. Sorry, Sammy. You want to know those modifiers. You want to know about code 99140. Don't forget about that one. When you have to put a patient under anesthesia emergent, like I don't know what your name is or your date of birth. I just pulled you out of a car wreck and we have to go to surgery right now because you have an arterial bleed or something, and we don't have time to stop and assess you for anything. We don't know if you have diabetes. We don't know nothing, but we're going to the OR and put you in under anesthesia. Be sure you got to know that code. The other code you got to know for this exam is 99100. Now, remember, with both of these codes, one alert, you got to know if the description of the CPT code states ER or age, do not use either of these codes. Same for P6. P6. If the code descriptor says the patient is already brain dead, like for example, code 01990, you can see that that CPT code descriptor says it's for anesthesia for psychological support for harvesting the organs from a brain dead patient. It just makes us and everybody else feel a lot better that we have the patient put under anesthesia, even though they're brain dead, they can't feel any pain. We're going to put them under anesthesia. But this particular CPT code requires no P6. Don't put P6 on that particular code. Same thing for 99100. If you have a patient who is under 1 year of age or over the age of, 70 years old, you add the 99100 for anybody that's less than 1 year or greater than 69 years old, I guess, is really what we should put right there, right? Because are we putting there over 70 or are we putting them, what are we doing? Is older than 70. I guess they can be 70. Okay. Greater than 70, use. Okay. But caveat to that is if the CPT code descriptor already has an age in it. So let's see, which ones already have it in there? They have some do nots underneath them. So like, for example, we've got code 00836. We cannot use, do not use 99100 because it says that the patient is younger than 36 weeks old, blah, blah, blah. It also has a do not underneath it that says you can't. Also codes like 00834, we can't use. Do not use 99100 because there is a patient age inside that CPT code descriptor. See where it says younger than 1 year of age? We can't use that. But every other code, like code 00820, if we did a hernia repair on a patient who was 6 months old or 71 years old, we need to add codes 99100. They're going to ask you one of these scenarios on the exam, or both. They'll probably ask you one about the ER one. I know they're going to ask you one about the 99100 being added on to a code like this. And knowing whether it goes there or doesn't is all you need to know about the anesthesia. Other than that, the only other thing you got to worry about in anesthesia is diagnostic versus surgical. Where is that? So like codes 01382 versus 01400. Those two surgeries, it's anesthesia for a diagnostic arthroscope procedure of the knee joint versus the anesthesia for an open or surgical arthroscope procedure on a knee joint, not elsewhere classified. This is difficult. I even struggle with this, but I know that diagnostic equals no diagnosis. That means we're going in, we're just going to go look-see because we have no idea what's causing the patient pain. And we don't know. Surgical means we know what's wrong. We have a diagnosis and we're going to go fix it. So figuring out the wording in some of their coding questions during the certification exam are so vague, or they're meant to trick you with play on words. You don't know if you're doing surgical and you don't know if you're doing a diagnostic with those two codes. It's difficult. Just do your best. If you see that there is no diagnosis, pre-op diagnosis, the only diagnosis you got is post-op, then you may be the 82. If you happen to have a pre-op diagnosis and a post-op diagnosis that may even change, you still may end up being in the 1400 right here. So if they had a pre-op diagnosis. So that's anesthesia. You're only going to have 4 questions. And I bet it's going to be about the babies. or older adults, knowing when to use this code, when not to use it. The QZ, QS, always something probably on the exam, and then your little ER thing, and your P1, P2, P3, P4. Oh yeah, to know the differences in those, like P1 is just completely normal, healthy person. P2 might be somebody that just has like one disease, like hypertension or diabetes, but they're under control. P3 is something like morbidity, obese, but also has diabetes or hypertension, that kind of stuff. And then P4, you know, you're going to have a very frail patient who's always under threat of life. So like hypertension, CKD, somebody's on dialysis for their conditions. Probably one of those kind of patients who's always coming into the office 3 days a week because they're going to die if they don't get this treatment. They're always in threat, but they're maintaining, but barely. P5 means we don't expect them to live, but we're going to go attempt the surgery anyway. And then P6 is, of course, they're already brain dead. So that's really all you need to know for anesthesia. Let me check chat real quick, and let me go to my first question for tonight, and then y'all can be looking at this while I'm catching up on chat. That's the first question for tonight. What, Travis? Y'all gonna go see that movie tomorrow?
I don't know.
Did she know what time yet?
Okay. She's still checking.
Okay.
So, Mom showed me this video. This proves that humans can be kind and nice. Cause, so like, you know, like.
Of course, humans can be kind and nice.
No, but like we aren't though. That's the thing. And she showed me this video. TikTok. It was about this disabled kid, and when he was like a new disabled kid, like a full wheelchair, and he could not move. He could only move his eyes, and I cried. Because it was so sweet, and the only person was this little girl that wanted to play with him, and like she tied a rope to his leg since he can't move his legs to play soccer with him. It was so sweet though.
Oh, okay. Cool beans. Glad you saw the video.
It made me cry.
Aw. Okay, let me check on. Travi's awful vocal today. What if you have questions for the first question with Modifier GX and the second code? There's guidelines in your books that tell you which modifiers go first. I believe I've gone over it before. Isn't it pricing modifiers go first? CPT modifiers go first over HIPAA ones. So if the modifier is in the CPT book, it goes first versus anything that's extra in the HIPAA book, like your Q weirdos ones. Hey, Samantha, good to see you. Yes, this live automatically gets saved to YouTube. Absolutely. Samantha, are you looking at headers before you look at CPT code descriptors? So if you're in an exam and you're doing this code, and maybe this code and this code is answers A, B, and then we've got C and D, right? Before you look at these CPT code descriptors, are you going back and looking to see what is the what is the header for this particular thing? It is an excision for these. Then if I come over here, what am I doing here? What's my header? And you may have to look back a couple of pages. This header is an EGD. Now I'm going to go look through my question from the bottom up, and I'm going to look and see, am I doing an excision or am I doing this scope? I'll look in my question. You're doing a scope? Okay, great. Then I know A and B go away. I know I'm down to a 50-50 shot. I'm doing just a scope. Then I look at my differences. Did I do a scope with a stent, or did I do a scope with thermal energy? And that's my only difference. And I'll look again through my question and only look for the words thermal energy or stent. If I find either one of those, then I know what my answer is, and I move on to my next question. Your exam should be just like that. You clear headers before you clear descriptors. If they're all under the same header, great, but a lot of times they're not. They're under different headers. 2 of them will be under like ultrasound, and 2 of them will be under fluoroscope. That's what they're testing you on. So keep that in mind, Samantha. Best advice right there is headers before descriptors. IOG, OIG, good gracious, was on her exam. Thanks, Go-Kart. I'm just catching up on chat. I know, my boys. He was so happy to see that video. What all do we need to know about OIG? Definition or what? Pull that up real quick. Right here, what you need to know about OIG is in their study guide. You'll need to list out what and have in your book somewhere, what is it? The Office of Inspector General, right there, OIG. What they do, they provide compliance program guidance for individuals and small groups, right? They have key actions that they work on for implementing, designing, conducting, internal monitoring and training, responding to stuff, and developing communication. And then what an OIG work plan might look like. That's about it. That's the only things that you need to worry about is this little paragraph and this little paragraph right there. Those 2 things. That's all you need to know about OIG. And it's in a study guide. It don't matter what year you got. It'll be right there. Super handy dandy. And they probably have a test practice question about OIG back here, somewhere around in here. One of these things. Probably. I don't know. Yeah, they got right here. Here's the test practice question. What OIG document should a provider review for potential problems, areas that will receive special scrutiny in the upcoming year? And that's what they call an OIG work plan. That's all. All it is. They just tell us each year, okay, this health plan, we're going to look at how many CKDs you're getting risk adjusted for, and we want to make sure that your labs are in compliance. Whatever. They always come out with new and fun things. If you don't have an AAPC study guide, but you're taking the AAPC CPC, this is helpful because it's exactly it's better than their courses, I think. It's just full of information of what they like to ask you questions on. I like their old study guides. They do a good job there. Hopefully that's helpful, guys. She said just the definition. And the definition of HIPAA. Yep, good. Perfect. All right, let's see what you guys, under HIPAA, what would be a policy requirement for minimum necessary? I can't say that word. What do they minimally need to have? What do they need to have? Only individuals whose jobs require may have access. Only the patient has access. Only the treating provider or anyone within the provider's office. And you guys said A. Perfect. Only individuals whose jobs are required to have access need to have access. Easy peasy with that one, for sure. All right, somebody asked me about codes 8, 6, 7. Let's go look. 8, 6. Eight, 6, 7, 8, 8. And 8, 9. You need to know what your differences are between an IgM test and just what the 8, 6, 7, 8, 9. You know, I don't have a lot on the second code, but I know where to find some information on it. I have on the first one, 8, 6, 7, 8, 8 is your ELISA, ELISA test. It's for inflammation of the brain. So we're talking about code 86788. Underneath that number, write ELISA. Over the top of the West Nile virus, put inflammation of the brain. The IgM, put equals next to it. It's a stain marker, and it turns fluorescent for that kind of stuff. But let me go find out a little bit more about 86789. Here, log on to work and see what coder scrubber thingy tells me. 86789. Sometimes it's not very helpful, but this one's in. Yep, let me see what. I just want to see what it says about 88 also, just in case. Okay. 89. It's not going to be very helpful, is it? Does the other one do it too? Yeah. Let's see. Yep. Are we doing... wonder if this one's more complex. Let's see. 8, 6, 7, 88. Does it change any at all? Yeah, it doesn't change at all. They both have the same exact descriptor. I hate it when it does that. They're not telling me what the difference is. Not at work, anyway. And then 867, 89. Let me see. 867. I need to just copy them both down so I don't have to go back and forth. Yep, they're both serum, they're both blood, or they could be spinal fluid. This one's specifically IgM. And then 8, 6, 7, 89. Same thing. They don't have to evaluate. So, yep, IgM. They don't have any difference in here. That's crazy. All right, and then she wanted to know about 86777. 777. Toxo. Oh, IgM. Let's go see what 86. Yeah, it's still the same thing. They're both the ELSAs. They're both good for interpreting positive or negative results. They're semi-quantitative value. Yeah. That's that one. And then anybody seen these codes on their exam ever? I don't have them pink highlighted. Seven. Yeah, they both have the same descriptor on both full code sets. They're not noting any differences at all. Oh, yay. My training from the lab is that the IgM is the most reliable or useful in determining recent infections, because most infections are undetectable within like months of getting them done. IgGs detect things once it's been in the body for a long time. So since the 88 is an IgM, we're going to have to assume that this code 86789 is like an IgG, and that is for testing for things that happen for a long time. It has to be in your system for a long time for it to show up for an IgG. But short-term, IgM is better at picking up things that happened within weeks instead of months. So what I would put is IgM for the West Nile for the 88, and for the 78 code is that these are the most useful in determining recent infections, and the IgG is for longer periods, even though it doesn't have IgG beside those other two codes, but hopefully that helps. Let's see, we're gonna put short, recent, we're just gonna put recent infection by 88, and then recent infection by 78, recent, and then 89 we're going to put long term, and then 777 we'll put long term. So there's your differences on those. And let's get back to our practice questions, if I can find them. There we go. Here we go. There's your next question while I catch up with chat. Which statement describes medically necessary services? I'll rewrite this. So we were doing 86788 means recent. Recent infection. So we've got 86788 recent infections, 86789 old infections. The 777 is old. The 778 is recent. So you can add that to your notes. This one, which statement describes medically necessary services? Providing a procedure or service based on cost of elimination of waste. Using the least radical services or procedures that allow the effective treatment of the patient's complaint or condition. Using the closest facility to perform services, or using an appropriate course of treatment to fit within the patient's lifestyle. B, least radical service. Medical necessity is using the least radical services that are allowed for effective treatment of the patient's complaint or condition. Let me get this scoochied down so we got it on one piece of paper. Which one of these is a mid-level provider? Is it a non-licensed PA, a provider withholder, a mid-level provider, an NP with a bachelor's degree. What do you think? Hey, PC, good to see you. Perfect. Easy peasy one with those answers. C, of course. Don't forget that a community health officer or a mid-level healthcare provider is also part of this. Community health officer, physician extenders, like a nurse practitioner, stuff like that, are all considered mid-level. Which of the following is not a function of the skin? What do you guys think? We have thermoregulation, sensation, protection, and vitamins. I know being out in the sunlight helps you create vitamins. I did not get my 10 minutes of sunlight today. I did ride in the car for 10 minutes going to the grocery store. I wonder if that meets the qualifications. Probably not, since I got the tint all over the car. What do you guys think? Diana just ended up giving you a subscription to the YouTube channel. I hope you can use it, and I hope you find it helps you out. Access to all my old workshops, if they're over 90 days, is super helpful, and access to the individual CPT code book prep videos should be super helpful too. I hope. All right, let's see. Yep, vitamins. Which of the following is an appropriate skin response to the cold? Does the dermal blood vessels vasoconstrict, or do the blood vessels vasodilate? Do we make vitamin D production that increases when we're cold, or do we have sebaceous glands that secrete increase? What do you guys think? I did make a document and posted it in my shop, just on my website. I didn't post it on Etsy. It lists out all those things, like if you need to highlight something in a book, note its differences, like those headers, descriptors, things like aloe, cadaver, living, the differences between flaps, that kind of stuff, flexible, rigid, inferior, superior, open, closed procedures, intra, extra, all that stuff that I'm always highlighting, underlining, or whatever, and my color schemes that goes with it. That's now in the shop if you wanted it. This one, of course, is constricting. What temporary HIPAA Level 2 code is required for use of an outpatient prospective payment system, OPPS, at the hospital? Is it C, G, Q, or H? Anybody got an idea on this one? Yay! Hey, Davis. How's it going? Are you wanting to become a medical coder too? Are you taking a medical coding course? Hey, Mommy. Some of the CCS people have to deal with these. Hey, Samantha. Well, let's get into that. It's our C codes. That is going to be in your HIPAA book. In the back of the book, it's going to tell you where those are at. You're going to have a form back there. What form is used to submit a provider's charge to an insurance carrier? Shouldn't be too hard, right? Are we calling it a UB04, a CMS 1500, a provider reimbursement form, or an ABN? If it's your first time here, don't forget, when you see those gift boxes show up, be sure to click on the 3 little dots on the right-hand side, hover over them with your mouse. You'll get a little thing that pops up that says to accept gifts, so that you can accept if I do try to give you a free subscription to my YouTube channel, that you can actually be entered into the winning. I don't actually pick the winner, YouTube does. I just send the money to YouTube. But if you hover over that little box that'll show up right here, it will, it's that blue box in the green box, the little gift box, the blue gift box, 3 little dots show up, and you can click on it, and you can add yourself to being able to be entered into the contest. Yay, Samantha, you won. Yay. Congratulations. I hope that helps you out. This one is the CMS 1500. This is just a list of some things, because these were the last few questions that I had made up for Wednesday, and I didn't get to them. And then this was the tail end of Wednesday's lesson that I had planned. There are things that I want y'all to make sure you do your homework on. Make sure you know something about these types of areas. So, of course, be sure to know what MRSA stands for. It could be on a medical coding exam. Be sure to know when the type of diabetes is not documented in a medical note, which one is default. Like if the patient's on insulin, but it doesn't say the patient has type 1 diabetes, don't pick type 1 diabetes. Know that type 2 is your default. Be sure to know that COPO, C-O-L-P, means vaginal, so that you are picking the right code when you're asked about that particular question. Be sure you know that adverse event means that a patient has a rash that is developed, like to penicillin, or they have decreased respirations due to a medication. It's all called an adverse event. Which statement is true when reporting burn codes? Be sure you know the guideline that we code the highest degree first. That means that if a...
Faisal Kadir has become a member.
Yay! Thank you for becoming a member. I hope it helps you out. If you have a couple of second-degree burns on an arm and a couple of first-degree burns on an arm, you code the second-degree...
$10 through Super Chat.
Ooh, Super Chat. Oh my gosh. You code the second-degree burns first, and then you move on to the first degree burns. And since she did 10, I'll give away 2 more subscriptions because that's enough for 2 more people. That's great. Let me get back up in here. So be sure and know something about these. Look on Quizlets for practice exam questions that have adverse event in them, anything that has COPO in it, anything diabetes related, super helpful. All right, let's get into some E&M practice questions for sure. Are we going to bill an initial or admit, hospital, consultation, an office visit, new patient, or an office visit established for this type of patient? The patient is seen for the first time in the office today for a 2-week follow-up hospital visit with Dr. W, who treated the patient while they were in the hospital, and the patient is feeling much better now. Patient's asthma is under control, his current medication regimen, and has no complaints today. Which subcategory E&M visit are we going to bill for today's office visit with Dr. W? Jamie, thank you so much for the super chat. I am going to give away 2 subscription memberships for that right now. There goes one. The diabetes question was on your CCA exam. Yep, I can see that. Let's give away another one. Thank you so much, JC, for helping out and giving to others here. That's super nice of you. Yay. Let me check chat. Me got a subscription. Yay. And so did Sharon. Awesome. Thank you again, Jamie. So the patient's is coming to the office for the first time in the office today. After being in the hospital and being treated in the hospital by Dr. W. Now they're seeing Dr. W again, but in his office practice. What are you going to bill? This is something that offices are going to want to know that you know how to code too, but also it's one of the things for the exam. Sorry guys, having issues. I gotta bring my laptop over here because I lost chat for some reason. All right. Okay, but the MD saw him in the hospital. Yep. Don't be putting no question marks. Be decisive. What is it going to be? Good job, Suzette, Clarissa, Amy. Yes, Samantha, we're going to bill established patient for sure. The patient has already been seen, just at a different location, by the same physician. There's no difference in the subspecialty. So, yeah. You can see the answer to this question in your CPT book. If you're in the 2023 one, we're going to be on page 4 and 5. Yeah, that last paragraph on page 4 and then the top of page 5. Super helpful paragraphs right there. Let me get back over here to this one. And there's your rationale. All right. Same thing. Are we doing a new patient, established patient? Are we doing preventative medicine? What are we doing? We have a child that comes back into the office for her scheduled child checkup. The child is doing well. Dr. S examines the patient. The mother has no questions or problems. What category or subcategory of evaluation and management are we doing? Don't forget, if your questions are appearing kind of blurry or whatever, don't forget there is that little wheel you can push and you can change. As soon as I get rid of the thing, skip. You can change your imaging on your playback. By tapping that, you'll get this pop up, because if you're at 480, it's going to be super blurry. You can change it to a higher picture quality. And then that way you're not at the 480, that you're at the higher picture quality. I see some of you guys on tablets or shooting this over their to their TVs or all kinds of stuff. So whatever you got to do to get it not to be blurry, but I'm trying to do my best here. I have it on font 24. I'm hoping that's big enough. Let's see. What do you guys say in chat here? You're welcome, Sharon. That was... Yep. So we are preventative, and the patient comes back into the office. That word back lets us know that they are already established too. So we're going to be preventative and established. Same thing. We have an elder patient who just moved and comes into the office for a visit to establish care for her hypertension and diabetes. The patient needs refills on the meds. Dr. J examines the patient and looks over the labs the patient had completed before coming. Dr. J determines that the patient's diabetes is uncontrolled with the current medications and changes the medications. What category or subcategory of evaluation and management code office visit are we doing for Dr. J today? What do you guys think? Great. That's awesome, Marcy. Good job. New patient. Good job. Same thing. Are we doing new patient or established? Are we doing an office consult, or are we doing a preventative established patient? Miss Betty is referred to Dr. S, an internist, during a hospital admission during a week-long stay. Dr. S discharges the patient from the hospital and told the patient to make a new patient appointment with her office staff within the following weeks to establish and continue care. How will Dr. S staff code the E&M professional service for that visit? It's okay, Jen. You got it. I got A's, B's, and D's. Oh my gosh, and a C thrown in there. What type of doctor is an internist? That may help with this one. So if it had said cardiologist, it might be different, right? Because that's just taking care of the heart, right? And that would change probably all this, because Miss Betty was just seeing this person for just heart conditions, right? But an internist is a doctor that can take care of everything from your head to your toes. They're also called internal specialists, but they can take care of everything. So it's sort of like a PCP doctor, but they specialize in harder cases that primary care physicians and that can do, but they are a PCP on steroids, supposedly, supposed to be, but they don't just do everybody from, and it's usually just adults. There's not very many internists that are pediatric specialists, but it's mostly adults, and they like to take care of multiple comorbidities. So like if you have diabetes and you have hypertension and you also have lupus, they love those kind of cases. They like multiple stuff. So it's a PCP, but on steroids. So some of you were talking about being a consult, which it could be if we were only talking about the heart or something like that. But since this is an internist, this is more of a PCP person. And when it also says the words to establish care, that means the patient is new, but also that means this doctor is going to take over and is going to be doing the care of the patient in total. So anyway, we're not going to be doing consult. It doesn't look like she was scheduled for a wellness exam, but this verbiage about call my office and make a new patient appointment and to establish and continue care is stuff that doctors and staff say at the hospital all the time. And patients think that they're making a new patient appointment, But in reality, as a coder, we know that we are doing something different, right? We can't make them an appointment as a new patient because they've already seen Dr. S and they know who Dr. S is, and Dr. S has already seen them. So they have to be just established. So B for this one, please. Yeah, and the word referred was very vague. You had to go off of the subspecialty of the doctor. So if it had been referred cardiologist, then like I said, we might be talking about a consult. And this doctor would not have been doing the discharge. So from the hospital, a consult would not have done a discharge. So if I did switch this to a cardiologist, I would have to change the sentence that said that the PCP or somebody else did the discharge. It wouldn't be this Dr. S, because Dr. S wouldn't have discharged if it was a consult during admission. Because a consult during admission is just to see one part of the patient, even though I'm taking care of the car wreck that came in, like the fractured neck and a fractured leg. If I was an admitting doctor who was taking care of all their fractures, and then I just asked for a consult on the cardio because they had some palpitations or something, or were known to have had atrial fib. But he definitely would not have been the discharging physician if it was a true referral. This referral was probably an ER doctor who didn't want to do the admit and referred them over to an internist to do the admit. Because remember, ER visits are just clinic visits. Hospital admissions, admit, is a different thing. That's a hospital. So they're two different services, too. If I'm not making y'all go crazy, but this particular patient, you just needed to know what type of doctor that an internist was. That was the big clue, is that doctor takes care of you from head to toe. It's a PCP doctor, and they did the discharge, so you know they're just an established office visit. Consults have to have things that are being done that just go back to another doctor to manage. All right, here's another one. Are we dealing with an emergency room visit, an admit, hospital, or observation care? Are we dealing with an ER visit and a hospital or observation care? Or are we dealing with an admit, hospital, observation, and discharge in the same day? Okay, Dr. T sees the patient in the emergency room and then admits the patient to observation for severe abdominal pain. Dr. T examines the patient and gives the orders to the nursing staff. Which category or subcategory E&M management codes would you select from the visit to Dr. T? What are we going to bill here for Dr. T? You're welcome, May. Hey, Jamie. 4th of July weekend. Oh, a lot of people off Monday and Tuesday. Oh, my goodness. Yep, it's got new appointment and everything in there. I wrote that last question, so that's why it was confusing too. I'm always bad. Thanks, Webb. Yep. If they go to the ER and to the office with the same doctor, it is always established. Yep. I've got B's and C's. Because I just told you that ER equals just a clinic, right? If I hadn't have just said that, you probably would have gotten this one wrong too. And that admit hospital is a different thing too. That means this patient who the doctor sees the patient in the emergency room, makes the decision to admit the patient into observation. That means we get to bill C. We get to bill the ER. And then, so we get a 99282, maybe, and then admit observation hospital care, a 99221. We get to bill both. Dr. T performed an ER visit and the initial observation care. You can refer to the guidelines that are in observation care. They're scattered to the wind, but I think column page 15 does a better explanation of it of the 2023 book. If you're on the second column, the second to the last paragraph. So not the very last paragraph, but the one right before it. On the second column, there's 2 rows on page 15. There's an area right there that helps explain this right there. Sounds like somebody's at my door. Sorry, guys. I thought one of the kids were coming in. Is that helpful? I was going to ask if that was Jen's question or AAPC. Yeah, that was my question. Good night from Alabama. Great. I'm so great. Page 15. Second column, second to the last paragraph. Would one try to bundle into the other if billed on the same day together? The ER is a clinic. Look at your, how can you bundle if you are looking at the very beginning of your CPT book for your place of services. Where is your ER visit? Our ER is a different code than our inpatient hospital. So our inpatient hospital is a 21 when our emergency room is a 23. Our whole place of services are different locations. One could be on the planet Earth and then the other one could be on the moon because they're different locations, even though they're technically inside the ER. Physical location doesn't mean anything. It's the place of service code that would separate out both those bills, if that makes any sense at all. But yeah, we are in 2 different places, first and foremost. even though technically they're probably still sitting in the ER, just under observation. SOAP. Hopefully you know what SOAP is. Where would patient's account of the illness be in SOAP? Does that look like that's spaced out too far? Nope. Just looks funny. Maybe it looks funny because it's all lowercase. I get so tired of hitting capitalizations and stuff. You can't accept it, Web, because you're already a subscriber. I have to wait for your star to go away, and then when your star goes away, then you'll be able to accept a gift. So right now you've got a star like Crispo. She doesn't have a star. She could win. And Diana, she doesn't have a star. So those guys could win. So you've either won one before or you've already got the subscription. This one is S. Good job. Subjective. What about this? Are we in the respiratory? Are we in the musculoskeletal? Are we in cardiovascular? Or are we in gast? When the physician or patient says positive BS, soft, no masses, bilateral tenderness in the lower quadrants, negative rebound, 1+4 guarded. What organ system is being examined with that documentation? What do you guys think? I see your teddy bear. Gastro. Good job. All right. Are we objective, plan, assessment, or subjective? Denies blood in urine during urination. Nocturnal uresis. Dysuria, urine frequency. What section of the medical record would this be found in? What do you guys think? Did my twinkle pop in? I don't know what I was doing when I did this question, but I got it wrong. I picked, hey, Anointed. Thank you so much, sweetie. I picked assessment for some reason. I don't know what I was doing, but good job, guys. Y'all got it right. Subjective. Got lots of rationale with this one for some reason. Some of them I don't get any. Some of them I can find some. Thank you, Anointed, for the support.
586 donated $1.49 through Super Chat.
D, subjective. This would be under, it's because the patient denies. If anything the patient says is always, always in the S. So when you see somebody talking and saying that they're denying something or they do have something, whatever, patient talking is always going in the subjective. All right. What type of documentation would be found in the assessment and plan and evaluation and management of the document? Is it the details of a physical exam? Is it the patient's account of the illness or condition? Is it the diagnosis and treatment? Is it the reason for the visit? What type of documentation would be found in the assessment and plan of an E&M documentation? Just this question is just written a little differently than the previous ones. I misread it too, Amy. I got that one wrong. I don't know what I was doing. You're very welcome for the videos. I'm happy to help. I hope I'm helping. I think we've covered a lot of detail today. Don't forget, I'm looking for people to join in on the podcast. If anybody wants to join in, talk about their job search, their classes, their just medical coding journey. Love to do some podcast with somebody else talking too. C is correct. Good job. Assessment and plan has the provider's assessment. Plan typically provides the medical decision-making information. The provider makes the determination, also known as the diagnosis, about the cause of the symptoms, which the provider's assessment of the problems. Based on the assessment, the provider creates a plan to relieve and resolve the patient's symptoms. All right, guys. If a patient is scheduled for an injection of the knee to relieve knee pain, the provider examines the knee prior to providing the injection. How would you report the services for today? Are we going to do a 99212 with a 25 or a 57 modifier? Would we do the procedure code or just a regular office visit? Simi, what are you doing? Cat's getting up. They're going to start circling me, wanting their dinner. Aw, thank you, Amy. That's awesome. I'm happy to help. What podcast? What are you talking about, Twinkle? My little podcast that I've been reading, the CPT book, it's on YouTube too. It is in a folder of just podcast. I've only been just reading the CPT book to you, trying to give you explanations of what I think the sentences mean. Hopefully y'all are finding that helpful, but it would be fun to do a podcast with somebody that did an entire course or took some workshops or had difficulties finding a job but did this and found one. Just your impressions and things. What helped you the most, even if it isn't my stuff? Whatever out there on the internet, or what person helped out the most, what study tipped helped out, whether it was mine or some others. Just love to hear from you guys too. Twinkle, you crazy. It's not the best, good Lord. I can't read, spell, or enunciate. All right, yep, we're just doing the procedure. If they're only scheduled for procedure, the doctor doesn't do a full head-to-toe evaluation exam, you cannot bill a 992 anything. You can only bill for the procedure. Keep that in mind for the next questions later on. When I look at this question, right off the bat, I start thinking about, what does the 25 modifier mean? What does the 57 modifier mean? I keep those in mind, and then I go look at my question. It looks like we've got 2 pages probably with this one. Yeah. So what are they saying? The MDM is high. How would this service be reported? I go back up here and look up here. What have we got going on? Patient was in the ER. They're having abdominal pain. Started at the belly button, moved to the lower quadrant. She's having chills and nausea, denies any vomiting. She plays soccer. She was unable to play this weekend. Her father has a history of colon cancer. They did a CBC, CT scan, showed a dilated appendix. They feel like she's in acute appendicitis, and they're going to proceed with an appendectomy. How should this be reported? I'm glad you found me too. That's awesome. She's listened to. Okay, good. Aw, you were about to give up? Yeah. Aw, I'm so glad you found me. That's awesome. I know during COVID, I just felt so compelled to make my first TikTok just because I downloaded TikTok just because I saw so many people spending their COVID money to buy these courses and they still weren't passing their medical coding exam. And I thought, Sammy, you know, I didn't even want to pass. I didn't even want to do coding, but I passed. And I knew that there was an easier way. There was an easier way. If I could do it by refusing to learn E&M, I didn't even want to learn it. And then when I took my test, I couldn't even find any of the codes because no one told me to fix my out-of-code sequences in lab and path and medicine. So 3 whole chapters of the exam, I was just A, B, C, D, you know, whatever. If I could pass and I didn't want to be a coder, I knew I could help. So that's how all this mess started. I just made a TikTok about it. And people were like, tell me more. And here I am, 2 years later. You never got any COVID money, Blondie? I had COVID money because the boys, you know, the little ones, they got money. I didn't get extra pay being in healthcare during that time. I don't think none of us did, but the groups did and the hospitals did. They got tons of it. But yeah, I did get some just because of the boys. And then they even got food card money. I haven't seen food stamps since, man, I got me my first divorce in like 1992. And I hadn't seen any of that. They sent home the boys a card for the school's lunch program for the summer. Like if they didn't, because they couldn't go to school or whatever, then they had lunch money that they didn't spend. So they sent it to us on a food card. I just spent some today because I keep forgetting to take it. And I've had that thing 2 years and I keep forgetting to spend it or taking it with me to the grocery store. And I'm still spending COVID money today, actually. I forgot all about that stupid card. And I was shocked. It still had $121 on it. I spent it today. I'm still spending COVID money, as a matter of fact. You used yours to start a business? That's awesome, Amy. I know a lot of people did. I wish I didn't do a PP loan or anything like that. I should have. I could have started this all up and done something with it, but that's okay. You went to school when COVID started and taken 3 tests. I have 1 try left. You work at a hospital? Yeah, if you put payer information in your head, you'll get the test questions wrong. So keep payer information out of your head. But you're going to get this. She got COVID money on her cards this week. Wow. Blondie, send me some of your COVID money. I know. I wiped out that card today. I was surprised. I always forget to take it. And I sure did. But that was from, I don't know if it was last summer or the one before. They sent us home with lunch money. I'm like, what? That was great. I wish they'd do that now. I had free groceries in I don't know how long. We got popsicles, pistachio ice cream today, cereal, milk. Not much. You know, it takes a lot nowadays to buy groceries, but we did get some ice cream and popsicles, which was nice. This one, we're going to do our level 5 office visit. We are going to do that 57 modifier for the decision for surgery, because she did have that decision for the appendectomy. You get to code for that. And then, of course, the procedure. Yep, decision for surgery. All right, we got modifiers 24, 57, 25, and 79. In January, a patient had a surgery on her bunions. And in February, she tripped and landed on her outstretched arms. This resulted in the visit to an orthopedist for pain in her arms. Oh, for the same orthopedist. For the pain in her arms. What modifiers should be appended to the office visit for her arm pain? What do you guys think about that one? Sammy, you want to go out? Let me let him out. Yeah. All right. I'm opening the door. There you go. That one. That little card, the Pandemic EBT. I've had this thing 2 years and keep forgetting to spend it. I was surprised it even worked. I didn't know if they just took it all back or what they did with it. I had it forever. So if you never got one of those and you had school kids at some point during COVID, I think every school gave away those things or whatever. I don't know. But that was crazy. I wonder what they do with our summertime money anyway. They got permission from all the teams now. Oh, nice. That is fun. Gosh, I have to pay a franchise fee to the AMA. Do they make you pay a franchise fee, Amy? You lose it if you don't spend it after 360 days. Wow. We have to be close to me having this over a year. Because if I got it even just last summer, we're into June 30th. So I wonder if today was the last day I could use it. I don't know what made me grab the card out today. Oh, crap. That was $100. That was nice. This one, she's seeing the same orthopedist for a different body part. We're going to do 24. Did anybody get A? I didn't see a whole lot of those. Saw a whole lot of D's. This question was written differently, but I changed up the answers and added D as the answer. The question came with D as none of the above, but I knew 79 would trip you guys up. So I added that down because it says unrelated procedure. So that was my addition to this question. But if you look at your modifier 24, it says unrelated E&M visit during a post-operative period. Be sure and don't forget about that 24 modifier. It is handy dandy. They use it during a post-operative period for unrelated E&M visits. All right, another one with 57, another one with 25, another one with RT. What would we do here? We have a patient who's been having problems with her right knee. This week, her knee was swollen up while she was at home. She's not having any fevers. Had a distal femoral something or another last week on her right knee. Which knee is having her problems? It's still the right knee. Okay. So, wonder if this is one of those things where she's having issues with the same one. Sequela visit, kind of like thing. Musculoskeletal. She's got full range of motion, cardiovascular. The procedure, what they're going to do is they did sterile alcohol. They gave her a local anesthetic, which is regional anesthesia, right? And they aspirated 1 cc of cloudy fluid out of her knee. Ow. And they sent it for cultures. They did an x-ray of her knee, showed her knee was in a good position. All right, so the impression was effusion of the right knee. She's to follow up in 10 days. And start taking an antibiotic because they did introduce a needle into the knee. What would you code for this particular patient for her knee injection? Don't ever second guess yourself with these questions or during the medical coding certification exam. Don't. First thought, go with it and do it. I did. I used the card today and now it has a zero balance. So That's good. And I spent more than I thought I did. Good gracious. It $190.77, and now there's no balance on it. So no balance. So yeah, I spent a lot. I've had that thing. I think I've had that thing for 2 years. I don't know why. Anyway. All right. I have also worked with a few and create my own designs, and I had their permission as well. Aw. Do you have to pay the franchise fees? No, but I had to make sure that I only used the pattern and colors they sent me. Oh, okay, yeah. That's nice of them that they send out what you can use without having to pay a franchise fee. That's cool. I have to pay a whole lot of money to the franchise conglomerate that is the American Medical Association. I have to pay them a whole bunch. Lord, I had to pay child support to AAPC today. They got $3,000 from me, and then they got $350 for the certification. They've gotten a ton from me lately. Woo. All right. This particular, groceries are crazy. I didn't even know I spent $230. Good gracious. Anyway, this particular one, we are going to code C. We're going to do the 99213 with the modifier to let them know that we also did a separate identifiable procedure that needs to bill along with our regular office visit. Remember, modifiers go on the first code in E&M, and then they go on the second code in CPT later on in the book, you know. Aspiration is not considered surgery, even though there was a decision to go into the knee joint. They don't consider that a 57. It's interesting. But I got some more questions, but I'll save those for Monday. I hope this has been helpful, guys, for sure. I'm working on some stuff for you guys in, like, I don't know. I'm trying to come up with some more one-sheeter stuff that could help you guys out. Let me see, where's this Word document? Right there. Can I switch it to this other thing? That study guide. Yeah. Like, if you were going to code just musculoskeletal injections, you need to know 3 things. What anatomy, what site, and how many was. So 3 different things. You can see I'm not a graphics designer. I need somebody to help me out here. But anyway, what part of the anatomy are we going to be dealing with? Is it a sinus tract, a tendon, a ligament, a trigger point, a joint? And then are we dealing with a shoulder, back, arm, leg? What are we dealing with? And then number. And you don't do the number of injections, you do the number of joints or number of muscles. And then if you're going to add radiology, you do this. But so I'm trying to come up with like a visual study guide for each kind of thing in the books, but yeah, it looks pitiful, but I gotta, I don't know. I'm not a graphics designer. So if anybody knows anybody that's a graphics designer that could help me out, that would be awesome. But anyway, I'm working on some stuff for you guys to help out visually and pare down some of this knowledge so that it's easier and it's one sheet does it for one particular thing, and then we move on to another particular thing. So I'm just terrible at designing something. I don't know. I appreciate you guys. You've fill me up with a lot of joy. I enjoy helping you guys and making a difference. They said it was an advertisement for them, so I guess they don't have many people crochet their logos. Oh, that's awesome. I think that's cute. You know, in our Discord group too, Amy, in the off-topic room, you can post links to your side hustles too there. Employees of AAPC. I know my child support is strong this month with AAPC. I had to pay back child support and current child support up. I feel like it. Oh my gosh. So now on E&M, are we now reading from the top down? No, not in general. In E&M, you know, guys, we don't do process of elimination with these codes, right? So process of elimination doesn't work. And normally, if I was doing this question and trying not to trick you guys, of course, I would just come up from the bottom up and see what did we do today, because all I need to know is what did I do today. And we did this procedure for today. Then I would see right here that we did cardiovascular. That's all I would need to know that we looked at other body parts other than the knee and we did a procedure. I would automatically know, and I would during an exam only look from the bottom up, and I would have stopped at cardiology, and that's as far as I would have seen. I would have never looked at none of this stuff, and nor would I have read any of this stuff during the exam. No. I'm just trying to confuse y'all today and make y'all pick the wrong answer. That's why I'm reading from beginning to end. But I never would have done that if I was doing this as part of exercise to show you how to handle a particular question on an exam. This is all I would have looked at, was seen that we did a procedure, and I would have seen that we did a cardiovascular eval. Just those two words would have been enough to tell me that my answer was definitely C, because there's no decision for surgery in a office visit procedure. There's nothing you can cut on that's going to be enough for that. You need to be in the ER getting a decision for surgery, and they're going to do like sew your face back together, you know. That doesn't work here. And yeah, I would definitely get rid of those. Thank you for subscribing, yes, to the YouTube channel. Please be sure and hit the subscribe button. It's free. Forgot about that. Trying to get my subscriptions up. I know there's more out in the community and so many that are watching, but just forget to hit the subscribe button. So that's cool. That other coding lady got some sort of a award from YouTube, and I'd love to have one too for the wall behind us. That would be cool to add to our little collection. Anyway, yeah, I'm just trying to confuse y'all. That's why I'm reading them from beginning to end. But for the exam, I would never do that. No, don't ever go near these questions. Don't read them. God forbid. Thanks, Victoria, for gifting a subscription. You're awesome. And Erica, too. Oh, my gosh. Y'all are so sweet. Y'all are killing it tonight for each other. Aw. Thank you, guys. Y'all are so cute. Yay. I'm so glad she won. That's awesome. She's been commenting and then not being picked as a winner. So that's cool. Yay. Thank you so much, Erica, for absolutely. That's awesome. Thank you, Victoria. You too. You're awesome. I know. Thanks, Go Kart. You love the format of these questions. You'd be really good if you take that certification for, if you like these questions. And I think you were getting all of them correct. You should take the certification exam for, because where did I get them from? Oh, right here, CEMC. Go Kart, you said you were getting all of them correct and you liked them. Then that means you need to go get this certification right here, because you could have those initials out beside your name. Go Kart, comma, CEMC. Because that's all this came from tonight, was from working in this study guide. So go get that certification, girl. You're ready for it. Yeah, the award play button. Yeah, award. Yeah, I've seen some of the other medical coding people win like those fancy awards that come from YouTube in the mail. They look big, huge placard thing. Yeah, it looks cool. I have more videos out too than they do. So, but I've only been playing around with YouTube, 6 months? So I know it'll take time. All right, guys. Well, I'm going to get off here. I'm sure my kids are going rapid in the house. And I haven't eaten today. I'm starving. So I was talking about all those groceries. I'm ready to go eat. So I'm going to go eat. And what is today? Today's Friday. So I'll be doing some book prep videos on TikTok, streaming them, and then I'll post them onto YouTube this weekend. I don't have any major plans that I know of. My mom wants to go to the movies to see the Raiders of the Lost Ark, I think, tomorrow. And then, of course, we'll be scootering around if anybody wants to watch me scooter on that crazy contraption we have now. I've only fallen twice, and I have not sent out the second set of cups thingies yet. No, I got to go through that because I got to go through the list and see, okay, who gets the smaller cup, who gets the bigger cup, who gets the mousy pad, who got the magnet, who got the file, the book file thing. Oh my gosh, it's a nightmare. I've got to go through it and see who won what. I know Twinkle's written out something for me and emailed me, but now I gotta go find the email and print those out. But yes, thanks for the reminder. I need to get that done too. And I owe somebody's daughter a cup because she was awesome and helped me out with something. And then I owe 2 people cups extra for something or another that I have in my scanned photos. I gotta go do. But yeah, I need to go to work on that. Yep. All right, guys. I'll see you guys off and on this weekend, and of course again on Monday, 6:30 Arizona time zone for another 2-hour Q&A with me and my foolishness. I will see you guys then.